My name is Ben Underwood. I'm an academic old age psychiatrist and I'm the R&D director for CPFT. Research is absolutely vital in improving healthcare. It's the only way that we will find new treatments and be sure that they work and can benefit people. And that's really at the heart of what we do. But along the way, research brings many other benefits. So for example, it's something that can really improve people's working lives and therefore helps with recruitment and retention of staff, which currently is an issue within the NHS. But it's also something that helps us look at our systems and the way we deliver care more generally to make sure it's as efficient and effective as possible. And all of this bleeds through ultimately to improving health outcomes for patients.
We are working together through research to improve the quality of life of everyone. The vision that we have is to live in a world where quality of life is not impaired by ill health. The Windsor Research Unit is a dedicated facility to offer opportunities for everyone within our trust, starting from our patients to the staff, to participate in high quality, ethically approved studies and clinical trials.
So CPFT has a fantastic variety of studies available for patients historically, and we look forward to increasing that still further. So we deliver research right across the age range, from children in our children's services all the way through to the very oldest patients in our older people's services. We deliver studies that are based around brand new drugs, traditional drug trials if you like, but we're also very keen to make sure that everybody's experience within CPFT feeds into research. So we have a large anonymised patient record which can be used to research to develop services, but also look at things like prognosis and the outcomes of different treatments that people experience. CPFT has got a very strong track record of delivering studies within mental health. But CPFT isn't just a mental health trust, it's a mental and physical health trust, and we're also delivering studies across physical health. We've pioneered the use of an app on a smartphone to help patients who are breathless manage their own condition, which is fantastic. We've looked at the use of antipsychotic drugs in patients with very late onset schizophrenia, where we had no idea whether the drugs were effective or not, and we were able to show that the drugs were extremely effective, so that has really changed management for that group of patients. CPFT was absolutely the forefront of the fight against the coronavirus. We took part in lots of studies, including of testing, but most particularly of vaccine trials. And we were the only mental health and community physical health combined trust that took part in many of these vaccine studies, which of course have had such an enormous impact on everybody's life, and in particular have thought to have saved over 1 million lives worldwide.
I'm extremely proud of the team that work here at the Windsor Research Unit, starting with the clinicians to all of the research nurses and the clinical research practitioners, our administrators. I am very lucky to be part of this team. I think CPFT is a very unique trust because we have been very lucky to enable basically all of our patients and the staff by the Windsor Research Unit to participate in high quality research. Our mission is that we are here to try to improve the quality of life of our communities by doing research with care.
So I'm very proud to work in research and very, very motivated to do it. I'm very interested though in the impact that it has on patients and how you can really see something that makes a difference. And it's that outcome for individuals that is the key thing that should drive us all to do more research. Who makes research possible at CPFT? Well, there are a lot of people that don't often feel the spotlight. And these are people in our R&D office, these are people that run our R&D database. These people are absolutely vital in delivering the research. But those are the people that are perhaps specifically badged for research. Outside of that, I think it is every single member of staff that actually makes it possible, and everybody who works here to make it part of culture, and that research is absolutely a core part of NHS business. But then all of that would be entirely wasted were it not for patients and participants that are willing to take part and engage, because without them we simply wouldn't be able to do anything at all. Nobody knows your condition or often how to manage it better than you do. And people are really interested in those ideas because we know that research that involves patients in terms of designing the questions that we're asking, how we're going to answer those questions and what the outcomes are and how those are shared with patients, always leads to much, much better research. So I would encourage anybody watching this that wants to take part. There will be information on the screen which will take you to our website. I would urge you to sign up there and get involved. This isn't something being done to you, it's something that we're doing together to make things better.
Research is fundamental and is everybody's business. So it is a call for all of us, wherever we are within the Trust, for every role that we have, to get involved in research. There is a place for everyone in research. Starting with patients, you are suffering. You have some conditions that maybe are making your life quite difficult. Participate in research, because that will hopefully now help you, but it will help the next generations as well. Every time you go to your GP, every time you go to your clinician, just ask, is there any research that is happening in this Trust that I can be part of? We offer opportunities in the Windsor Research Unit to be part of these research programs, but as well as, if you want to know or learn a little bit more about research, do come. This is a unit that is welcome and is open for everyone in CPFT. Spend time with us. Talk to us. If you may have some ideas about how projects can be run and improve the services that you are working with, you can be an ambassador. Talk about how research is important and how to improve the quality of life through research. We need to find cures for diseases that are impairing and affecting our quality of life. So let's do it together. Come and work with us so we will make a change.